Pharmacist at the Robert Mangaliso Sobukwe Hospital, Sean Zille, says patients find themselves sent from pillar to post to get medication.
Another factor that affects them is like the staff attitude to clinics, availability of medicine. So they choose to go to different facilities because the type of services they get, then they go to a specific service. We see that here by this hospital, for example. They bypass the clinics because they say when they go to the clinics, there's no medicines or the staff attitude is not to their liking or it's long waiting times.
Nokuzola Reed is a case in point. She says she has returned from her local clinic empty-handed more than once after she went to collect chronic medication for her family member.
Like you will go to a clinic, you go for a certain sickness or a certain medication that you need. And then they will tell you, no, it is not available right now, come next week. Now they're telling you, no, our numbers are full, you need to come back tomorrow. But what about the sickness that you have? What about the medication that you need for that time? What about the medication? Maybe that time your medication is done. You don't even have medication to drink for the day. But now they're telling you tomorrow, and you are critically ill by that time. You understand? That is how bad the clinics of our country is. The people, I'm not going to say the clinic, but the people that work at the clinics, that's how bad it is, how bad they are.
Reed's frustration is not an isolated case.
The services here don't make me happy because you get here at 7 o'clock, but we will sit here. Sometimes you don't get your pills till 4 p.m. They close and tell you to come back tomorrow. And then you have to stand in a line again the next day. We are tired.
I brought the child and I got like literally one box for medication just for pain. Whereas the problem is not properly addressed. She was not even examined. So for me personally, that is just a no-no.
We get treated very bad because most of the time the doctors are not here. We wait sometimes until 3 o'clock in the afternoon to get help. Nothing is on time. It's just laziness.
The Northern Cape Department of Health insists that its clinics are able to cope with the demand for medication.
Through the management and implementation of the stock visibility system, our pharmacists in all our public health facilities are able to detect where there are potential shortages of any specific medication provided through institution and in turn place orders on time at our provincial medical depot to mitigate any risk associated to public health facilities running short of any medical supplies on a daily basis.
The department says the stock levels of medication at all its medical depots in the province's 5 districts are at 90%. Karabo Sioko, SABC News, Kimberley.